align ourselves with the education, with the universities, who are the ones that are providing the expertise and the knowledge to have clinicians care for us, because we're going to be patients in these hospitals or in these clinics. And we need that skill set that gives us the comfort as a safe environment. So I just want to relay the severity of the problem. I walked the ICUs last week in one of our hospitals, and these people are worn out. They're tired. Again, I go back to the statement, 12-hour shift, dressed up, in gear, caring for patients, and if you're in an ICU and you're in a ventilator, 70% of them will die in front of you. Now you think about the stress level and the resilience of that staff, and what are the resources that we as providers need to provide these professionals. We call them heroes. I'm sure you've seen the hero signs, because they are heroes. And we're very proud of our workforce, but as human beings, we can only take so much stress. So I beg that this committee works out something with regard to bridging the educational component and the healthcare providers in the market, because otherwise you're looking at a 3-4 year run before we can see light at the end of the tunnel. Thank you.
Thank you, Mr. Fernandez. Ms. Greene, you're invited to the podium, and you are recognized whenever you're ready.
Thank you. I'd like to say ditto to everything that everyone else has said, because much like they have said, I have some very similar statistics for you and some numbers for the nursing homes across the state. My name's Tracey Greene. I've been a licensed nursing home administrator for the last 21 years, and I currently serve as the Vice President of Operations for Southern Healthcare Management. We operate 29 nursing homes across the state and take care of approximately 3,000 residents. I am also the chair of Florida Healthcare Association's Emergency Preparedness Committee. Florida Healthcare serves over 600 nursing homes and assisted living communities, and I oversee our emergency management activities on behalf of them. Prior to COVID, my company employed approximately 4,500 employees to care for our residents. When COVID first hit, we lost several hundred employees due to child care issues, fear of COVID and bringing it home to families. And we also lost many employees to staffing agencies, much like you have as well. And those numbers continue to decline today. Our employees can go to higher paying jobs in other industries, such as fast food, Target, Amazon. They're all raising their rates, and we are in competition now with CNAs for them. Our personal care attendant program has been highly beneficial. So for those of you who are part of passing that bill last year, thank you. It has helped us out in ways that we couldn't have imagined. I went through the PCA program myself and worked as a CNA in several of our facilities throughout the year last year. COVID cases have continued to decline in long-term care since vaccinations came out, which is great, but our workforce challenges have doubled and tripled in many instances. Today, our centers have 8% fewer residents in our beds, but we have 15% fewer staff to take care of those residents. Our company alone has hundreds of open positions, just like all the other providers across the state, and we are really struggling to hire and retain staff. We are using temporary agencies to fill shifts in all of our facilities, and in several centers, we're having to limit admissions. Majority of our facilities are 120 beds, and in many cases, we have to limit the number of patients that we can have in our centers due to lack of staff. All of this comes at a significant cost, adding to the financial challenges brought on by the pandemic. We're losing staff to industries where jobs are easier and the pay is higher. We have some buildings where 1/3 of the nurses and CNAs are from agency, costing us at least $300,000 a month to pay for these agency staff. In the fourth quarter of 2019, we spent $100,000 in agency. In a similar quarter this year, we spent $2 million. And we're not alone. The use of staffing agencies across the long-term care profession is up by 250% over the last year. For example, Florida's 6 state veterans nursing homes typically operate at 98% capacity. Today, they only have 67% of their beds occupied. There is a waiting list of veterans who need skilled nursing care. However, the VA cannot admit these veterans because they cannot recruit the staff needed to take care of them. Those veteran nursing homes typically have between 10 and 12 open positions on average, but today they have 256 vacancies. Like us, all but one of their homes are using staffing agencies for direct care workers to provide the care that they need. This results in an access issue for veterans who need and have earned veterans nursing home care. The staffing agencies have unfairly taken advantage of the general labor shortage in the market by enticing away our center staff with offers of higher pay and then selling the staff back to us at a much higher cost, sometimes as much as 100% over what the agency is paying the staff. We're doing everything we can. We have raised wages in all of our centers multiple times this year. Every time we raise our wages, the staffing agency, a week or two later, sends a new contract, I see you shaking your head, and they raise their rates by $10 an hour over what we've offered. It's a cycle that we just can't seem to get out of. We are incentivizing our own staff. We're paying up to $10,000 in sign-on bonuses. We're offering $250 to just pick up one extra shift. But we're still losing our staff to staffing agencies. The cycle is unsustainable, and there doesn't seem to be an end in sight. Typically, we'd be able to recoup some of these costs by taking on new admissions from the hospitals, but as I said, staffing shortages are forcing us to limit the number of admissions that we take. The inability to take on these patients, they are happening across all providers across the state. Florida Healthcare conducted a survey and found that 52% of nursing homes across the state have been forced to reduce the number of admissions they take. The consequence of letting this crisis go unsolved, it really are significant. It's going to create an access issue for hospitals looking to discharge patients to our care centers, as well as individuals in the community seeking long-term care. This causes hardships for vulnerable seniors and veterans who need assistance and further exacerbates provider financial challenges. Our direct care costs, which is primarily CNAs and nurses, are up by more than 20% compared to pre-COVID. Statewide, nursing centers costs have increased by almost $42 per patient per day compared to pre-pandemic time. That's a $600 million increase to facilities statewide. Labor is the primary driver for this increase. Just last week, one Florida provider, which operates 17 nursing homes across the state, filed Chapter 11 bankruptcy as a result of the pandemic-related financial challenges. We're afraid they're only the first. The impact of this bankruptcy filing is yet to be seen, but the negative effects are inevitable. I became a nursing home administrator in the year 2000. I love this industry, but I'm really afraid of what the future holds, and I appreciate your time listening to us.
Thank you very much, Ms. Greene. All right, ladies and gentlemen, we have great news. Help has arrived. So what we're going to do is, because I know, and this members gives you a moment to keep writing those questions down. We have been told that if we allow 5 minutes, you can each have your own microphones, and I think that will facilitate the asking and the answering of questions. So I'm going to say, we're just going to take an informal 5-minute recess. Don't go very far, everybody, because as soon as we're up and running, we will get to questions.